Hello, and welcome back to the Living Well podcast by Jefferson Health. I'm Carly Williams.
And I'm Jessica Lopez.
In today's episode, we're discussing what happens after you or a loved one is diagnosed with cancer.
Learning you or a loved one has cancer can be extremely difficult to process. We hope our conversation with medical oncologist Dr. Andrew Chapman and nurse practitioner Tintu George can help you know what to expect and how to proceed with care to make this stressful time easier.
Dr. Chapman is the director of the Sidney Kimmel Comprehensive Cancer Center and a practicing geriatric oncologist focusing on care delivery in older adults with cancer. We'll talk to him about what a comprehensive cancer center is and why where you get your care matters.
He'll also talk about a new program at Jefferson called Same Day, Next Day Cancer Care, which allows recently diagnosed patients to connect with an oncology clinician via telehealth in 48 hours or less.
We'll then dive more into the new program and discuss some of the top questions patients and their families have after receiving a cancer diagnosis with Tintu George. For now, here's our conversation with Dr. Chapman. Welcome to the podcast, Dr. Chapman. To begin, can you explain what is a comprehensive cancer center?
There are 57 comprehensive cancer centers in the United States, and this is the highest designation that is given to a cancer center from the National Cancer Institute, and it generally indicates that there is depth and breadth in terms of the science within the cancer center, educating the next generation of leaders in the field of cancer, and providing the highest quality most cutting-edge cancer care for all the communities that we serve, with the charge to lower the cancer burden throughout all of these communities. And so part of what we do as a comprehensive cancer center is to understand what are the issues afflicting all of the patients that we see throughout our communities, and then trying to bring that information to the bench where scientists are trying to develop the most cutting-edge treatments for those patient populations.
And you sort of just alluded to it, but why should this matter to patients?
The patients should expect the highest quality, safest cancer care that brings to them the most advanced techniques, the most advanced technology, the most advanced treatments, what is considered the best possible options. And we know from studies that patients who are treated at comprehensive cancer centers actually do, in fact, have better outcomes. They have access then to not only the most qualified leading researchers and clinicians in the field, but also to those treatments that are so important to them.
Thank you for that overview. Can you talk to us now about why the Same Day, Next Day Cancer Care program was developed?
So the mantra that I put out as a cancer center director is that every patient, regardless of where they enter our front door, and realize that we have 17 hospitals in the original Jefferson Health, and now with Lehigh Valley Health Network, where we have 32 hospitals. And so part of the responsibility is that we create access for every patient, regardless of which door they come through, to that highest quality, safest care. And we want to do that in person's community. And so by creating the Same Day, Next Day program, what we have done is given immediate access to patients when they're diagnosed with cancer to a clinical team who will see them within 24 to 48 hours through a telemedicine visit, will assess their records, will get their care process moving very rapidly, and assure that they are navigated to the appropriate cancer specialist for what they need, whether that is a surgeon, whether that is a medical oncologist, a radiation oncologist, or all of the above. And so it's really filling the need of immediate access for these patients, regardless of where they are throughout the entire health system.
And that's a nice segue to our next question. We're hoping you can break down what the benefits are of working with a multidisciplinary team in cancer care.
I think that what the multidisciplinary teams bring is tremendous expertise across the treatment of that specific disease. And what that does is it creates a very balanced evaluation where the opinions are coming across the different disciplines of radiation therapy, surgical oncology, medical oncology, support services, so that we really understand in a very holistic way what the best opportunities are for that individual patient. So it enables the team to utilize their extensive expertise to tailor a treatment plan that specifically meets the needs of that individual cancer patient and their caregivers.
I'm wondering if there's anything else that comes to mind about what makes the Sidney Kimmel Comprehensive Cancer Center so special.
Within my own field of interest, we've been in the forefront of pushing the care delivery for older adults with cancer and addressing the aging and cancer interface. We recognize the importance of the rapidly growing population of older adults that are being afflicted with cancer, as well as the older adults who are surviving with their cancers and the unique needs that this patient population presents. And for well over the past almost 15 years, we've been at the forefront of pushing the high quality care for older adults as a very important underpinning for the care that we deliver. We are an age-friendly health system through the Institute for Healthcare Improvement, and we have received national and international recognition for our efforts through the Senior Adult Oncology Center in terms of our evaluation and shared decision-making to assure that older adults with cancer are receiving care that is meaningful to them and is helping them to achieve their goals. We are one of only a few centers in the country who offer this unique care delivery model. There's also several other areas that the Cancer Center has had developed cutting-edge science in the field of uveal melanoma. This is a particular area where we have patients internationally coming for this expertise. We've also had great experience in terms of neurosciences and cancer affecting the neuroscience system. And this is really but to name a few, because literally in every area of cancer care, the Sidney Kimmel Comprehensive Cancer Center has excelled with every disease type that afflicts patients throughout all of southeastern Pennsylvania, southern New Jersey, and now the Lehigh Valley.
That wraps up our conversation with Dr. Chapman. Up next, nurse practitioner Tintu George will provide more insights into the same day, next day cancer care program and the most common questions patients have after receiving a diagnosis.
Thank you so much for having me. My name is Tintu George. I am a nurse practitioner with medical oncology at Sidney Kimmel Comprehensive Cancer Center at Jefferson Health. I have graduated from Jefferson with my acute care nurse practitioner degree, and I'm board certified in acute care and advanced oncology nursing practice. I've been working in oncology for the past several years and very excited to be here today. Currently, I work with the same day, next day program at Jefferson.
To begin, can you tell us a little bit about what role a nurse practitioner plays in the care of a cancer patient?
So nurse practitioners and physician assistant, together we're trained to care for our patients in different settings. We're actually called advanced practice clinicians, or APCs. In oncology, we work together with our physician colleagues to provide highest quality care if possible for our patients. We order imaging, take care of biopsies, assistant biopsies, do biopsies, monitor treatment response, help with any symptom management patient may have. And ultimately, our goal is to provide the highest, best quality care possible for our patient.
And what are the first steps a patient should take after receiving a cancer diagnosis?
That's a great question. And that's something that I hear a lot. So one of the first things I say, because cancer care is so complex and the diagnosis can be life-changing, if you could just try to take a deep breath and try to process the news that you just got or the information that you just received. And then try to collect as much as information about your disease as possible. What type of cancer you have, what stage do you have, what are some treatment options you may have, and then anticipate some of the roadblocks you may face in terms of, do I need to take time off from work? May it be like financial problems that may come up with cancer diagnosis. So just trying to think about that in advance if you could and plan for that and ask questions about those particular things can be very beneficial.
And we understand there's a new service at Jefferson called Same Day, Next Day Cancer Care that might ease some of patients' anxieties.
Yes, we're very excited about the same day, next day cancer care at Jefferson. Our goal is to see a patient within 24 to 48 hours of their first call, and we see them virtually, so patient can be anywhere, they can be at home, and we do these visits virtually and try to collect as much as information as possible during these visits. Our goal is to make sure we get all your records, make sure we assess your biopsy report or talk to you about the pathology in detail. And we usually go over your symptoms during these first appointments, what problems you're having, and then try to connect you with the right provider. Make sure you're connected with one of our oncologists or surgeon or radiation oncology, whoever they need to see in a timely fashion. So these visits are great, and I think it's such a big step in our cancer care.
Definitely. And I'm sure the patients have a lot of questions. So we're wondering what the top questions patients have
Yes.
asked after receiving a cancer diagnosis.
Yes, again, cancer diagnosis can be very complex and very difficult to process. Yes, these visits, we discuss a lot of the questions patients have. I highly encourage patients to write down these questions and bring the questions to your appointment. Again, some of the questions we discuss are the type of the cancer, the stage of the cancer, some of the standard treatment approaches for your particular kind of cancer. Sometimes the questions get very specific in terms of if someone needs surgery, they ask about, how is my recovery going to look like? Am I going to be in pain? How is my pain going to be managed? Will I be needing help at home? Am I going to be able to work through this treatment? So we discuss a lot of these questions and financial problems. A lot of these questions can be discussed during our first appointment.
And what about top anxieties or worries? And how do you help provide comfort and support?
Some of the anxiety can be related to, it is a change in your daily life. Again, it's life altering. So how am I going to be able to continue my life and continue with some kind of quality of life during this cancer diagnosis and treatment? Where we then connect you, we assess the barriers and patients who need extra help, additional resources, we connect you with. We have a team of social workers, we have a team of financial counselors. So we connect you with the appropriate supportive care resources that we have, and we highly encourage our patients to participate in those extra resources that we have. We also encourage you to join a support group. I feel like it's so important because when you hear from people who are going through these same situations, it may be same diagnosis. I think it's very important when you hear their perspective on how they're handling things. I think support groups are great resources, but we do have a very integrative support care system in place. So please use our resources and we'll be able to connect you with the type of resources that you need.
That's great. And can you explain the different stages of cancer and what they mean for treatment options?
Sure. So typically we say there are 4 stages, stage 1 through 4. In some cases, there is a stage 0. And stage 0 being a precancerous or a very early stage cancer. Stage 1 is also can be a very early stage cancer, versus a stage 4 is what we call metastatic cancer, meaning it has spread from the original location to another part of the body. Once it is metastatic, it's not curable in many cases. It can be still treatable. So our goal is to identify if there is a cancer at that precancerous stage or even at early stage. The outcomes are much better when a cancer is diagnosed at an early stage. Our goal is to make sure we identify the risk associated and provide appropriate screening and diagnose at an early stage. But yes, there are 4 stages for cancer.
And for patients who call for an appointment with the Same Day, Next Day Cancer Care session, what are some of the types of questions or topics that really can't be best answered during that initial touch point?
That's a very good question, Jess. So yes, we discuss a lot of these things. A lot of questions about your diagnosis and your symptoms during the first appointment. However, we don't come up with a treatment plan because cancer care, it's very complex, so is the treatment. We want to make sure you're getting the best care possible, and we connect you with your oncology team. And as a National Cancer Institute designated cancer center, we have a very comprehensive approach when we treat our patients. Our physicians, our physician colleagues, they have multidisciplinary meetings where they discuss each patient cases and they come up with the best treatment plan possible for our patients. The treatment decisions are not made during the first appointment, but a lot of your questions can be answered, and we can really connect you with the appropriate provider and order your imaging. So we're not waiting around, wasting any time from your first appointment until you get to meet your provider.
How can patients communicate their feelings and concerns with their healthcare team?
I highly encourage patients to communicate with their team. It's so important that you feel comfortable enough to talk to your providers and your team. The comfort level, I feel like it's very important, and not feeling intimidated by all the information that you're being thrown at. It's important to bring maybe someone with you who could speak for you, because sometimes even though we're saying a lot of information, you're not processing that. So someone to be with you, to listen for you and take notes for you, and feeling that comfort level with your provider. And sometimes it takes more than one visit. Sometimes it takes more than one provider. I encourage patients to get a second opinion or even a third opinion, because it is important that you hear from multiple providers and make a comfortable, best decision possible for you.
Yeah, that's such valuable advice, that to realize that when you're getting this kind of information, it shuts down the processing part of your brain to be able to keep up with it.
Exactly.
What are other sources of support that are available to cancer patients and their families? You already talked about support groups, but
Yes, we have multiple resources for our patients, and I can touch base on some of them. It could be financial counseling, because again, cancer care brings on a lot of financial liabilities for the patient. So talking with someone about that. We have support groups. We have one of the things that I refer all my patients to nutrition counseling, because lifestyle factors can contribute to cancer diagnosis or risk for cancer. So meeting with the registered oncology dietitian, I feel like is very important. To see if there's anything you could change in your lifestyle dietary. We have smoking cessation program. We also have prehab and rehab programs for even cancer survivors who are going through some of these lingering effects from treatment. For example, lymphedema. We have lymphedema providers at our cancer center who can see you and treat these problems. And talking with other similar minded patients who are going through similar situations, that's where support groups come in play. We also have social workers who can probably help you with. Some people need transportation services. Our social work team is great, and we usually connect with those teams, and they can provide a lot of resources for you.
And how can caregivers get some of their own mental and physical health while providing support for a loved one with cancer?
Yes, it can be life-changing for the patient and for the caregiver with the cancer diagnosis. So being a caregiver for a loved one is a very difficult job, and most of the time it comes out of nowhere when you expect it the least. And it can be very confusing and very stressful. Again, taking some time to process this news that you got about your loved one, and communicating with your loved one in terms of what exactly are their needs, what are they going through, and really trying to get an idea of how can you help them. Sometimes they want to do it all and they don't want to bother you, and they're trying to do this on their own, but just communicating with them to let them know that you're there and you can help them through this journey. And I can tell you from my personal experience, I was a caregiver for my mom who went through a cancer journey, and it can be very difficult. And especially if you're not in the medical field, you don't know about a lot of the resources or services we have, it can be very tough. That's when it's important for you to take care of you first. The same concept as you put your oxygen mask on first before you take care of the person next to you. Just taking care of your mental and physical health while being there for your loved one is the key. It's common to feel the stress and the anxiety that comes with it. So communicating with other family members, looking into what other resources your family has. Is there more than one caregiver for your loved one? And having that support system in place. So if you need to take a break, you at least have someone else to lean on. And also support groups are great for family members, where you can talk to other patients and their family members who are in the similar situations. I would say definitely communicate, and also reach out to us, and your nurse navigators are great resources where we can help you and your family members through the journey.
it seems like communication and staying informed really are such high priorities. I'm wondering how patients and their families can ensure they're getting the best possible care and staying informed about their treatment along the way.
Very good question. And luckily, we live in a place and a time where we have a lot of great resources and a lot of great centers for treatment. It is important that you are being informed about your diagnosis, your treatment. And I highly encourage our patients to use our My Chart system, which is the Jefferson portal or the online portal. And it's very transparent. You have access to all your records, all our notes, so you can stay informed. And also when you communicate, when you see your providers, ask questions. There is something that you don't understand. And we know that it is hard. A lot of the terminologies are very new. It can be very difficult, but it's okay. Ask questions. If you need to hear from more than one person, one time, that's okay. We also have nurse navigators or nurse practitioners like us that you can call to ask, okay, I didn't quite understand what happened. Please explain to me. Staying informed is very important. And also use the resources you have, online resources you have, and people like us communicating with us is very important.
I'm wondering, was it the personal connection with supporting your mom that kind of made you passionate about being a nurse practitioner within cancer care? Or what does drive your passion for doing what you do?
Yes, thank you for the question, Jess. Yes, when I moved to the United States, I decided to go back to school and I was looking for my career. And right before that, my mom passed from cancer. She was only 54 with metastatic cancer. So being there with her at that time and taking care of her with the minimal resources we have at that time was very difficult. That really made me think about what can I do for others who are going through the same situations. So here I am after many years and really enjoy what I do. And really, I feel like I can bring a personal experience to our patients and provide the best care possible. Yeah, so that played a big part in me working in oncology.
Thank you so much for sharing that. And I'm sorry to hear about your mom.
Thank you. But with all the resources we have now, cancer care is constantly evolving, which is very exciting.
Be sure to check out the show notes for additional resources, including the link to the Living Well blog, where we publish full episode transcripts.
And as always, if you enjoy our podcast, we truly appreciate a rating on Apple, Spotify, or wherever you listen to podcasts. The full podcast episodes are also available on our YouTube channel at Jefferson Health.
Production support for today's episode provided by Brittany Rafalak and Barbara Henderson. We're your hosts, Carly Williams
and Jess Lopez. Be well.